my channel. I am Heather Tiedemann with Century 21803 Realty, and today we have a special guest.
Tripp Whitesides with the Tripp's Advantage.
And we are going to talk about health insurance, which I know is the funnest topic in the world here. Many people are moving here and they have questions, so I thought I would interview Tripp, see if we can get some answers to that. Before we get started, I'm going to ask that you like and subscribe to my channel. I greatly appreciate it. And let's hop on in. Okay, Tripp, so I know it's kind of a complicated question, but could you give us the average cost of what insurance would cost for a family of four?
Sure. Thanks, Heather, for having me. First off, the average cost for a family of four is going to vary widely, depending on the factors like your location, your zip code, your plan choice, and your coverage levels. Just to kind of give a basic quote on that, just say a family of four making roughly $67,000 a year. I'd say with two children, they're going to say roughly $1,609 a month in subsidy, and they can qualify for plans as low as $0 up to just under $500 a month, depending on the plan that they chose.
Okay, that's good to know. And are there any coverage differences between South Carolina and perhaps other states?
As far as that goes, I would say that the coverage differences between South Carolina and other states could include variations like Medicaid expansion, state-specific regulations, and what's available in the area. It's important to do your research and compare plans based on your specific needs and circumstances.
Okay, that definitely makes a lot of sense. So when they're moving here, are there any waiting periods or limitations for pre-existing conditions when transferring their health insurance?
So in general, the Affordable Care Act prohibits insurers from denying coverage or charging higher premiums based on pre-existing conditions. However, there might be waiting periods or limitations depending on the specifics of your insurance plan.
Okay. That definitely makes sense. And are there any special regulations in South Carolina that may be different in other states?
So in South Carolina, there are some special regulations related to insurance marketplaces, Medicaid eligibility, healthcare provider networks that could be different from state to state. And it's another case of it's essential to review those regulations when considering a move or change in your insurance coverage.
Okay, perfect. And what would be the process of transferring your current health insurance to a health insurance plan in South Carolina?
That process would be typically involving contacting me to inquire about your transfer options. We would compare plans from different insurers and help you enroll in the new plan that best meets your needs.
Okay, that seems like a pretty easy process then.
Oh yeah, I can have it done in 15 minutes or so.
Oh wow, that is quick. And does health insurance generally cost more in South Carolina or less than the national average?
So like I said, once again, it's a variable thing. Costs are going to vary in South Carolina, but they may be influenced by factors like demographics, the healthcare provider networks, state regulations. Once again, that would be worth comparing your prices with national averages. Would help you determine if costs are higher or lower than where you're coming from.
Okay. I know it's kind of hard to do it based off of all the states versus South Carolina. Sure. So what would be the process of finding a new primary care physician or specialist when moving to a new state?
Okay, that's another benefit of using a local broker like me that knows the area. Anytime you're moving to a new state, finding a new primary care physician or specialist would involve researching your local health care providers, checking their credentials and specialties, and scheduling appointments for consultations. Also, utilizing online resources and seeking recommendations from locals can also be helpful in that situation.
Okay, perfect. So are you able to help them navigate knowing which physicians are in their plan?
Sure.
Okay.
Certainly. And like one of the things we always do is if you're comfortable with the doctor that you're currently seeing, we will make sure that doctor's in network and you can continue to see that same doctor if you're already an established patient. And one other thing, I wanted to speak on with the ACA marketplace. It's something that's called the family glitch. Now, that's something that was resolved a couple of years ago with the marketplace. Whereas, let's say you have a husband and wife, and one spouse is offered group coverage to their job, that other spouse has an option of either going on the group plan with that spouse is offered the group coverage, or going on the marketplace and receiving subsidy. So that's an option there. Maybe the group plan is very expensive, and they're want to look at other options. That would be a way for them to get some subsidy to help them choose some additional coverage that would or not additional coverage. I missed that one. I'm sorry.
That's all right. That is all right.
That would be a way to help them find some alternative coverage instead of the group plan, to kind of give them some other options.
Okay. That would be awesome, because I know a lot of people, they move here, they may have a spouse that has a job, but it would be too expensive for them, so they could still go in the marketplace and find something.
And it gives you an option if you have children too, that they can go either or.
Okay, that's good to know. Mm-hmm. So talk to me a little bit more about Medicaid and Medicare in South Carolina.
Certainly. So Medicaid and Medicare, it serves to provide health care coverage for low-income individuals, seniors, and people with disabilities. Now, those eligibility requirements are going to vary. So it's important to understand the specific details of each program. Like in typical or Medicare is going to be for folks that are going to be 65 and older, unless they're on disability for 24 consecutive months. Regardless of their age, they would qualify. They would be automatically enrolled in Part A and Part B in Medicare. Okay. Medicaid is more for low-income folks, and there's different levels of that as well.
Okay. And is that something you could help them with?
I could certainly help them to navigate that process.
Okay. Mm-hmm. Well, I appreciate your time. Is there anything that you wanted to add or talk further about?
Like I said, it's just the most important thing is just to go with a broker that you trust and that you feel good about speaking with, someone local that knows the area, that knows what's out there, because some carriers might not be in network with certain plans or certain providers. So it pays to have somebody local that knows the local market and to be able to get through that process.
Kind of the same as if you're looking for a realtor.
There you go.
You want someone that really knows our area and can help you find something that works for you in South Carolina. Because I know we have some nationwide brokers that, maybe you may think is a good option for you, but that normally is not the case. Knowing someone that knows South Carolina specific laws is going to greatly benefit you. So I appreciate you joining us. I am going to drop Tripp's contact information down in the description box or in the caption, depending on where you're seeing this video. So you can reach out to him if you have any further questions. He's very happy to go in depth with it, look at your specific situation, and be able to give you a more targeted example of whatever coverage you're needing.
All right. Thank you, Heather.